It was fine. I had a staycation in Doha. How about yourself?
Pretty much the same. And actually, I did go to Abu Dhabi, so I've had a nice little break.
Oh, that's good.
And I think everyone's feeling recuperated and back to frustration in the traffic and travel and everything, returning back to normal on the roads.
I know. It's always nice, though, to get away. And I think in Doha, you never seem to have long before there's some kind of holiday or visitor or something just to break up your normal routine, which is quite nice, isn't it?
Yeah, it's true.
Yeah.
Keeps things fresh.
It does. But talking about that traffic, sorry, out there, if you're sitting in traffic again, you may well associate, a bit of stress with blood pressure, right? So this is something that I've been asked to talk about, is, of course, blood pressure. It's an area that maybe some people don't know too much about. And, of course, we all have blood pressure, so we need to know that. It's important to know what your numbers are. So just to get... Well, Laura, do you happen to know your blood pressure?
No, I don't. I was going to say this kind of comes into the same mythical rounds of metabolism and things like that. Where you know a lot about it and you know that high is bad and low is bad.
Yes,
so
but what are these numbers? You go to the doctor and they put that cuff on your arm, pump it up a little bit tight, and then they go, that's fine. And you don't have a clue what these mythical numbers are, right? Well, it's about time that we probably should all know what our blood pressure actually is. So let me just tell you first, what is blood pressure? It is the force of blood that presses against the walls of your arteries. So a little bit scientific for you. So when it's too high, it actually raises the heart's workload and it can cause serious damage to your arteries. So that's why people associate high blood pressure with things like strokes, because it effectively clogs the arteries up and creates too much pressure on them. So over time, an uncontrolled high blood pressure will increase your risk of heart disease, stroke, like I've said, and even kidney disease. These things are all connected. So it is important that you know your blood pressure number. So the normal pressure number is 120/80. Okay, so you'll see these numbers. The top number is called systolic and the bottom number is diastolic. So you don't need to know that. That's just a bit scientific. It's just the different pressures of the blood leaving the heart and re-entering the heart.
Okay.
Bit too complex, but as long as you know...
You can wow your doctor by being like, is that my...
Exactly, my systolic or diastolic numbers there. So that's what your ranges are. So if you've had your blood pressure taken recently and it's, 120/80 is normal. So mine normally is about 110/60. So it's like I'm a little bit towards the lower end of the blood pressure scale, but 120/80. If it's a little bit higher than that, let's just say somebody had 130/90, that's now hypertension, high blood pressure. So you'll hear that word hypertension. That's just another word for high blood pressure. So it's very important to know because there's different stages from 120/80 being normal to like 130/140 is like pre-hypertension. 140/160 is extremely high, and then it gets up to even like over 160/100 is really high as well. So anything sort of like sounding a high number, a little bit frightening. A low blood pressure reading would be like 90/60. So like I said, mine is normally 110/60. So it's kind of okay, kind of low. So there's different things that you can do, to help your blood pressure. People whose blood pressure is above the normal range, though, you really should consult your doctor to find out, why it's like that and what you can do to, sort that out. What's important to bear in mind, though, with blood pressure is it depends on when it's taken. So fluctuations do occur due to different times of the day. For example, if I took your blood pressure, Laura, after running 5 kilometers, what do you think it would be?
I'm guessing higher.
Exactly. Yes, it would be higher. And if I took it with you lying in your bed first thing in the morning,
lower.
So it's that kind of thing. So for example, caffeine can really ramp up your blood pressure. Obviously stress, anything that raises your heart rate. So if you go to doctors, and I've done this, I've been nervous, and I've thought, what if it's high? My heart starts to pound. It actually has delivered a higher reading. So
I've had the same thing. My doctor said that, like, were you stressed when you came in here? Yes, I was worried or whatever, Didn't feel well. What's wrong with me? And then at the end, it's like, oh, I know what's wrong with me. Everything's fine.
That's right. You feel a bit relieved, don't you? And often, the reason that when you go to a doctor and they take your vital signs, your temperature, your heart rate, and your blood pressure is to also find out if there's something wrong with your body. So if you're actually fighting an illness or like just a virus, your blood pressure will be higher. Like my husband had a little virus recently. He felt a bit sick and somewhat, and they took his blood pressure and it was high. He doesn't normally suffer from that. And the doctor said it's just because your body is fighting this it will come back down again. So it may just be that it's at that moment in time. What you're looking to find out, though, is your average. So if you're constantly having high blood pressure readings, that's something of a bit of a concern, and it would be good to have that checked out properly. So you may also have heard that high blood pressure, hypertension, is often called the silent killer. Have you ever heard of that?
Yeah.
Yeah, which sounds a bit frightening. I'm sorry at this on this
daggering
Monday morning we're being a bit, scary, but it is quite an important thing to know. And the reason it's called that is because there are no symptoms.
No.
If you know someone who's got high blood pressure, can you tell me what symptoms that you would know? If you look at a crowd of people, who could you point out that has that? You actually couldn't.
No. I've heard that people with low blood pressure are sometimes more susceptible to feeling dizzy or faint. So that's
true.
like one gauge, but for higher, nothing.
That's
I know
true.
of.
And that's certainly something with myself having hypotension. That's the opposite, low blood pressure. I often do sometimes feel dizzy, like if I stand up too quickly. Basically, it's from the blood pooling in the legs. So if you're maybe sitting down a bit too long, or you're in like a position with your head over your heart, okay, so you're bending forward for a long time and you come up too quickly, your blood pressure changes quite rapidly. So you can often feel dizzy and a little bit nauseous. But to look at, the hypertension, because there are no major symptoms as such, it can be very difficult to know if you have it. That's why it's very important you have it checked out. But there's also some reasons that can contribute to you having a high blood pressure. So one of the top reasons being smoking. Okay, so if you're a smoker, you're more susceptible to having high blood pressure due to the clogging of the arteries and other, issues that it causes, as well as being overweight and obese, because normally they come hand in hand with a poor diet. A poor diet would probably lead to build-up of plaque in the arteries. So these things are all connected. Again, lack of physical exercise. So it's not really sounding good, is it? If you're smoking, you're overweight, you're not exercising, there's probably a good chance you have high blood pressure. Also, if you consider that if you have too much salt in your diet, or you consume too much alcohol, you're a little bit stressed, this will also contribute to having high blood pressure. So just, have a think about these issues that you may have in your life. If you are feeling stressed, there's a good chance that your blood pressure's went up a little bit. Also, genetics and your age can have a factor. Normally, people who are older do have higher blood pressure because over their lives, their arteries have actually built up some plaque and what have you. If you imagine your artery is a tube and there's plaque in that tube, of course, when the blood tries to go through, it's harder because it's not clear. So the pressure building up on those walls. So that's what it effectively is. So you have to be a little bit careful of that. So that's why it is, I always say this, it's very important to take care of your health and eat well and exercise. It's not just for what it looks like on the outside. It's the inside.
Important inside.
Exactly. It's inside too. So, Laura, you mentioned, some symptoms for people with low blood pressure. Do you know any symptoms for high blood pressure?
Do you know, I don't think I do. I guess all I would associate it perhaps with is perhaps feeling like maybe if you had like if you felt like a tightness in your chest or like I'm thinking more of stress, I guess.
Yeah, it's that kind of image, isn't it? If you'd say, right, picture someone with high blood pressure, I always imagine an overweight man in a suit with like a red face looking very stressed. And actually that's about right, And bear in mind, symptoms can be different things, but some of the symptoms of high blood pressure are severe headaches, fatigue. You can have these chest pains. Of course, this could be something else, but it's to bear in mind. Difficulty breathing, and irregular heartbeat. Your heartbeat maybe is really fast too often. This is a sign of stress, of course, as well. So just to have a little think about this. Going back to silent killer, the worrying thing with this is that actually half of people don't know they have it. So that is why it is really important to know what your numbers are and understand them. So there's a recent sort of trend now that you can buy these at-home kits, which it's actually not a cuff that goes around your arm, but it goes around your wrist. And it's a little, automatic machine, and it will tell you what it is. So with these now being on sale in most pharmacies, and certainly here in Doha you can find them, it has definitely helped bring those numbers down of people who have hypertension, because they now can know that they have it and they can get the right treatment for it. There are things that can be given to you to help you with high blood pressure, but for me, I'm certainly an advocate of trying to adopt a healthier lifestyle. Simply by doing some more exercise, watching what you eat, you will actually reduce your blood pressure. You don't necessarily need to have medication unless it's quite severe. So, definitely go and speak to your doctor and find out, first of all, those numbers and what you need to know. Another question I'm often asked, is it genetic? Can I get it? Well, anyone can get it, but certainly it does run in families. There are certain people who are more likely to get high blood pressure. I did already mention smokers, but also pregnant women. You know, there's such a thing as pregnancy hypertension.
That doesn't surprise me because you get pregnancy diabetes.
Yes,
so I can imagine that you would.
And it's the strangest phenomenon. And once you deliver it goes away. But it definitely comes from obviously the stress that's put onto the body. So you might find that you've been healthy and then all of a sudden you're pregnant and you've got hypertension. So it's something to check on. And again, I've mentioned people who are not looking after their health and what have you. But to bring in that diabetes role, there is a correlation between hypertension and diabetes. So having high blood pressure, can lead to and make worse many complications of diabetes, including kidney disease, which is quite severe. So people who already have diabetes, they do tend to have high blood pressure. There seems to be a correlation. So just to, have a check on that. I've also mentioned hypotension. That's the low blood pressure. It's not as anywhere near severe as hypertension. And people who are pretty healthy and have low blood pressure, without any major symptoms, it doesn't normally cause any concern. It's just probably from, like I said before, you being in a position where you've been sitting a long time and the blood just pools in the legs or anything like that. So it's quite common in elderly people, but it's not a major issue. It's more the hypertension. And for treatment, speak to your doctor. It's always best to try and follow a healthy and active lifestyle. There's a diet now that you can actually follow, and it's called DASH, and that's the dietary approach to stop hypertension. Effectively, it's eating more fruits, veg, whole grains, low-fat dairy, fish, poultry, and some nuts. So it's just trying to get you to stop eating so much red meat because it's known to have, cholesterol effects that will harden your arteries a bit more, and saturated fats and things. So reducing your sodium, which is your salt intake, as well can have a really big impact on someone with high blood pressure. So bear that in mind. But definitely visit your doctor and have your blood pressure tested. And if not, you can try one of those self kits. It's always nice to keep a check on it at home.
We have actually, funnily enough, my mother's a nurse, and we've got a ye olde ancient blood pressure tester at home.
Yes, the little puff thing.
The kind of ones you see in the doctors that comes out like it's in like a big metal case. Ooh. So we do have with a huge, not thermometer,
very clinical,
but very thermometer looking like. It's pretty cool actually to have.
No, I always find it fascinating though, because on one hand it's scary, like you cannot tell if you have high blood pressure, so it's quite a little bit scary, but it's always reassuring to know that if you do, well, there's something that we can do about that, and if you don't, that's fine. You're healthy and you can keep on that level. Definitely get it checked out though.
Perfect. Okay, well, we will see you again on Wednesday.
Yes, Wednesday I'll be back here, so we will see you then.